Today we are going to demonstrate how to take a mandibular anterior periapical radiograph using digital sensors. Before grabbing all of the necessary items, make sure that you place a bib down on the top of your workstation. To take a mandibular periapical radiograph, you will need a cassette containing the necessary instruments, a bite block, rod and arm, and an aiming ring. The bite block is for the patient to bite down on. The rod and arm will hold the ring in place. The ring will help you center the radiograph, and the anterior sensor is what will capture the X-ray. Now you will need to prepare the X-ray station. To do so, you will take 3 protective barriers and place them over the X-ray panel, the X-ray exposure button, and the computer mouse. Next, place a plastic bag over the patient's chair, then hook the sensor up to the computer. To assemble the X-ray sensor, select the anterior rod and attach it to the bite block. Next, attach the aiming ring to the rod, but be sure that the ring is centered over the bite block. This should resemble a stair step, not a scoop. Next, secure the sensor onto the bite block. The white side of the sensor should be seen when looking through the ring. We are going to begin by first selecting CMS 18 on the top drop-down menu. Next, select the lower anterior template on the computer. We need to select the correct sensor that we will be using, and to do so, you need to click on the icon on the left-hand side on top of the screen. A small box will appear on the lower right-hand side of the screen, indicating that your size 2 sensor has now been activated. Turn on the X-ray machine and select the appropriate setting on the control panel for an adult or child patient, as well as select the mandibular anterior tooth setting. Be sure to also adjust the rectangular collimator so that it is in the vertical position. Once all of this is done, you are ready to seat your patient. When the patient is seated, you can adjust the headrest accordingly to support the patient's head. Place the thyroid collar around their neck for protection, then ask them to remove any objects that would interfere with the image quality. This would include glasses and anything removable in their mouth. When placing the bite block in the mouth, make sure the bite block is tipped horizontally and then raise it to a vertical position once in the mouth. Have the patient bite down so that the bite block is centered between the mandibular central incisors, teeth number 24 and 25. You can also ask the patient to smile to check yourself. Once everything is correctly placed, slide the ring forward on the rod as close to the patient's face as possible. You can also instruct the patient to breathe through their nose if needed. Lastly, line up the position indicating device so that it is parallel with the arm of the beam alignment device and the collimator is centered with the ring. Leave the X-ray room and stand behind the barrier looking through the window to make sure the patient is remaining still. You can now expose the film until you hear the beeping sound end. An ideal radiographic image should display some aspects of the lateral incisors, apices of the mandibular central incisors, and surrounding bone. Repeat the previous steps for the canine. Again, ensure the bite block is tipped horizontally and then raise it to a vertical position once in the patient's mouth. Once everything is correctly placed, slide the ring forward on the rod as close to the patient's face as possible. Next, angle the beam so that it is perpendicular to the buccal surface of the canine to open up the mesial contact between the canine and lateral incisor. Leave the X-ray room and stand behind the barrier to capture the radiograph. An ideal radiographic image needs to capture the apex of the lateral incisor and canine. After capturing all the images needed, You will need to escort the patient back to the waiting area and then return to clean up. First, debag the unit and remove all plastic barriers. Following this, place all the instruments used in the cassette, then take to the chute. Make sure when cleaning up that you disinfect any areas that may have been contaminated by the patient. This also includes the thyroid collar, the X-ray tube and head, and the patient's chair.